Hi there, I'm Dr. Nemechek, the guy who invented the Nemechek protocol for autonomic recovery, as well as for autism, developmental disorders, and learning disorders in children. I want to talk a little bit about what I refer to as the awakening in kids. Now, the awakening is a phenomena that parents will observe after they start the protocol in a child with autism. Okay, this does not tend to occur when you have, excuse me, a child with just developmental disorder or a simple learning disorder like ADD or ADHD. And what the awakening is in general is a seemingly worsening of some symptoms, and now the difference between, as you know, kind of my inflammatory spectrum, the difference between just ADD, which is cumulative brain injury, or and then also somebody with some developmental delay in ADD, them and autism, is that autism has the addition of that chemical being made by the bacteria called propionic acid. And in animals, and then what you see clinically with patients, the propionic acid tends to be kind of like a sedative on the kids, as well as maybe even a slightly hallucinogenic kind of psychotropic kind of chemical compound. And so you may have a kid with some just mild developmental issues, maybe a little focus issues, like they're going to end up having ADD, and then something worsens your gut bacteria. That could be an antibiotic, anesthesia, vaccine, a probiotic. We see a whole bunch of different things that can do that. It'll worsen it, and now the bacteria makes this propionic acid, and your children, two things kind of happen. They become just like sleepy, zoned out, kind of like they're on too much drug from the psychiatrist. They aren't even now looking at you. They're kind of walking around. They're isolating themselves in their room. And then you see these weird kind of behaviors, okay? They'll be staring at the ceiling fans for a couple hours, or the light, playing with a light switch, or just looking at their fingers and so forth. And so that's the kind of core effect between autism and the other groups. And and this chemical seems to have this sedating effect on the children. Now, as they go along, they're getting some injuries, okay? Just routine injuries, kids hitting their heads and falling down, or their emotional traumas, or other inflammatory things like illnesses or fractures or surgeries, seizures. All these things are kind of injuring the brain, and they build up more and more neurological damage through that cumulative brain injury process I discuss. And then now, so here's where the awakening comes in. We fix the gut bacteria, that propionic acid level drops, okay, which is only in the autism. The propionic acid level drops, and the kids kind of snap out of it in a way. So in one respect, they're suddenly like staring right at you, okay? It's like they've been taken off some drugs, and now they're like, more clear-headed. They're looking at you. They have more intent to their purpose. They want to grab you by the hand and try to tell you what they want. They may not be able to speak, but they're trying to point to things. They're much more interactive with people and much more direct. But the other thing that happens when they come out of this is doesn't always happen. Things can kind of worsen. They can become more anxious. You get more stimming, whatever the behaviors are, or they can't sleep as well. They may have a little more tendency for self-harm. Some kids might get kind of aggressive. Some kids are more apt to be a flight risk. They just take off at the park running. And so what is causing this? All right. Most of my work is done in adults, and when they have autonomic dysfunction from cumulative brain injury, many of them are anxious, very anxious. And part of this, it's kind of a confusing picture in autonomic. So part of this is due, we believe, to a release of noradrenaline. It's a fight or flight hormone, and that the body's trying to boost blood pressure with that may contribute to some of this. So you have this fight or flight, panicky kind of hormone being released. Another part of it is a inability, so you'll see that in the adults. Okay, so it's not uncommon. People are anxious and whatever, and they can't sleep, and once you fix their brains, they get better. So now in the kids, what are we seeing? I think part of it is similar in the children, that they have a release of noradrenaline. Part of it can be the awareness of their situation can cause them to release noradrenaline, just the distress that they're having from that. And then a third part is their inability to modulate your emotions normally, and that's done also by the autonomic nervous system. So you have sympathetic, parasympathetics, okay, and it's a balance. So sympathetics classically kind of your fight or flight kind of thing, emotions, and the parasympathetics are your calming, resting, kind of health-inducing part of the brain. So what happens here is under normal circumstances, say you're in traffic, okay, you leave your house, there's not much traffic in your residential area, and your parasympathetics are modulating the intensity of your reactions to the challenges you face while you're driving this car. All right, you're driving along, everything's okay, and maybe then suddenly a ball rolls out in the street, and your parasympathetics will change. They actually weaken, and that allows your sympathetics to become, oh my gosh, you hit the brakes, you're worried about killing somebody, you have that little surge moment. But that reaction is actually being controlled by your autonomic nervous system because it's working correctly. All right, now, and then after the ball rolls and you get past and the kids get the ball and everything's okay, you're back in the car, you're driving again, the parasympathetics kick back in gear, they calm you down, and now you're driving along feeling fine. Okay, that's how we go through our whole days as adults. All the interactions with people, all the things that happen, our ability to modulate, to interact with people, to negotiate stressful situations, all of that's being controlled by the autonomic nervous system, okay? In children, that gets broken. And they have the inability to modulate those emotions. So again, in their mind, even though they may just be driving in a little residential area, it's calm, there's nothing going on, they're constantly, they can't regulate, they're hitting the brakes, they're fearful something's going to happen. Or it could be even the opposite. There's, children running in the street, people on bicycles you might hit with a car and everything, and your brain can't even engage any caution behavior, okay? Now, in the emotional world, we refer to this as, when this is broken, as internalization or externalization of emotions. So internalization of emotions is when you have an excessive parasympathetic response and your emotionality is kind of turned inward, as the name implies. This is kind of, your kids will isolate themselves in the room, they're anxious, they harm themselves, they bite, they headbang, they're depressed, okay? That kind of stuff is internalization and is a function of an imbalance of your autonomics, typically general excessive state or excessive reactivity of the parasympathetics. Externalization of your emotionality is a weak parasympathetic response. And so here you have more aggression, more anger, you have stealing, you've got flight risk, those kind of things. So what we're seeing with this awakening in kids is this combination of effects. The sedative effects of propionic acid goes away. The kids are, lightheaded because their autonomics are broken. That's making them anxious. They're aware of their circumstances. That can make them more anxious. They have trouble modulating their emotionality like we can as adults through this kind of day-to-day stuff. So you're having these exaggerated kind of responses, okay? Now, the good news is around the 4 to 6 week mark, parents often will report that they see it's getting better. It starts calming down. And what you're seeing when that's happening is that the brain is actually starting to repair itself, okay? Because actually what the Nemechek protocol does is it doesn't really repair the brain. It repairs the repair mechanism so that the brain can fix itself, okay? So you fix the gut bacteria, propionic acid goes away, the kids kind of snap out of it because the sedative effect is gone. You're seeing these kind of exaggerated behaviors that are all kind of happening in the children. And then they start to decline and get better, okay? That is the repair phase. And so now, if you don't see that improvement in about 2 months, okay, this is where, if you've read my blog, get rid of all the supplements. We want to, I'll typically kind of bump up the fish oil and olive oil doses, and then typically things start to recover, all right? Some parents that are have this belief that the inulin does this and that they go up really low. So no, you get the same awakening if you use rifaximin, the antibiotic, as you do with the inulin. It's just that if you start inulin and they're kind of, having this intense awakening, and you cut the inulin dose down, you don't get as much control of the bacterial overgrowth, and your propionic acid levels go up, and that's a sedative, and it calms them down. So more inulin, less propionic acid, more awake. Cut back the inulin, more propionic acid, more sedative effect. So that's really what's happening here. Now, that's not a bad strategy to start low and work your way up because you're trying to get the brain to recover, but that's just so you know, it's not the inulin doing it, because we see this exact phenomena in kids that use the rifaximin. All right. So I hope you found this a little useful and insightful about the awakening. Unfortunately, it's a process. If kids have this, that we seem to have to be able to get through. We're trying to work on some new techniques to help kind of speed that up, or to maybe make that less distressful for the child as well as the family. And anyhow, hope you find this useful. It's Dr. Patrick Nemechek, Nemechek Autonomic Medicine, Buckeye, Arizona. Have a great day.